Hello, my name is Alyssa Giancola, and I am the Account Director at Regen Med. In the video today, I will be doing a brief walkthrough of the Spinal Muscular Atrophy Circle and the surveys within the protocol. If you'd like more information on how our system works, please use the link here to our Insights Overview video. First, I would like to walk you through what a circle looks like. This is an example of how a circle appears within a physician portal. All data within this video is illustrative. At the top, you will see the circle name along with the description. As we scroll down, we see our Circle Analytics section, which contains scoring groups and compliance and adherence. The scoring groups are formulas that take numerical data from the surveys and calculated data output. These include patient-reported outcome measures or PROMs, which are captured in patient surveys. Scoring groups, however, are not restricted to PROMs. In this circle, you can see there are additional measures that have been calculated with the survey information, like the weekly dose of the pharmaceutical treatment. A bit further down, you can see the observational protocol. This is a layout of all the surveys that will be completed throughout the study by both patients and doctors. As we keep scrolling down, you will see the indication and treatment sections. These appear here for the physicians and will also appear in the patient portal benchmark to give patients more information about their condition and treatment. If we scroll back up to the observational protocol section, we have the ability to see how these surveys will appear for your patients by clicking Simulate. Our surveys have ample functionality and versatility. This circle is aimed to collect outcomes data for any patient with SMA. Because the ages of the patients can vary vastly, there are different ideal PROMs a patient would complete. You will see here that by indicating who is completing the survey, the patient or a caregiver and their age, the appropriate PROM will appear. This survey will appear throughout the designated follow-up intervals. Here, the follow-ups occur at 2 weeks, 3 months, 6 months, 9 months, and 12 months. The system sends these surveys automatically at these time points after the treatment date, eliminating burden on providers and their staff. Patients or caregivers completing these surveys will give providers the ability to evaluate the efficacy of their treatment plan. The clinical surveys are aimed to collect clinically significant data with minimum burden on the provider. We aim to collect the appropriate information in a shorter survey. All questions in clinical surveys are optional to allow providers flexibility when completing these surveys. In this circle, we ask the provider to indicate the SMA diagnosis type, genotype, how the patient was diagnosed, their gross motor function measure score, as well as other significant data around the patient's condition. Here, there are some additional surveys that the provider can complete to illustrate changes in treatment and/or changes in the patient's condition. Thank you for taking the time to watch this video. I hope it gave you a better understanding of our platform. We hope to be working with you soon.